Hi,
Hi.
my name is Diana Ruiz, and I am a BSW student, and I am interviewing you for the purpose of study for my class, actually.
Okay.
Um, so first, let's begin with confidentiality statement. All your statements are recorded and kept confidential, and only with your written consent we will um, it won't divulge any of your information. Writing up this research paper, I won't, use your name or anything of the nature. The only way we can break confidentiality is if reveal something about immediate danger to an elderly, a child, yourself, or a neighbor. Then I will, have to report that. Um, are you ready to begin this process?
Yes.
Do you have any questions at all?
So when you write your paper, are you giving me a Jane Smith name, or you're not
Yes,
going
you.
to use my name?
No, you will be John Doe.
Okay.
Or Mrs. John Doe.
Okay.
Okay, so let's begin. So begin with introducing yourself.
Okay. My name is Brittany. Brittany Rosas, I guess, is my full name. I am a BSW student. I do work full time. I am an assistant I am a case management assistant at Banner Desert Hospital in Cardin Children's Medical Center. So every day I work side by side with the nurse case managers and the social workers. I assist them in discharging and discharge planning of all our patients. Specifically, I'm on the pediatric side. I have a daughter who is going to be 9 next week on November 15th. I'm hoping I become engaged this year, but I guess we'll see, because it's not my question to ask. My boyfriend and I have been together for 3 years. We are domestic partners. We have car loans together, or a car loan together, a house together, health insurance together. Everything but some fancy jewelry is all I need there.
I'm sure it's coming.
I'm hoping so. I think he's imminent.
So let's talk about a little bit about what you do for a living. So you say you work with Banner as a caseworker?
As an assistant case manager.
So exactly what do you do there?
So I basically do all the behind-the-scenes processes of discharging a patient. If the nurse case manager or the social worker, the MSW, interviews the client, or realizes, or the doctor lets them know that the patient's going to need a front wheel walker, a wheelchair, any kind of home care, I get notified of it and I send out all their information. I arrange who will be their provider based on their insurance. I basically process every referral. If they need to go to a skilled nursing facility, the social worker will get the patient's choices, and then I'll send the information out and work on getting it set up. Usually it includes sending everything about their stay, their medical records, chest x-rays, those kind of things. And then getting auth from their insurance and having the facility set up transportation. Specifically, my assignment is WIS, PEDS, OBS, and ED. So that's all women infant services, all pediatrics, all observation, and all emergency department. My assignment is significantly stressful. Some days are a lot to handle. Other days I tend to feel like I have downtime, but on my stressful days, it's definitely hard to prioritize. Sometimes it definitely feels overwhelming, having so many
caseworks.
Yeah.
Caseloads, so to speak. So you work with the social worker.
Yes.
So is that the reason why you want to become a social worker?
Not exactly.
What brought you to social working?
Well, I worked in the medical field for 11 years now. I started as a medical assistant when I was 18. I had my daughter at 21, and my daughter was happy, healthy, 10 fingers, 10 toes, wonderful first year of life. I was a pre-nursing student. I had just completed all my prerequisites. When my daughter was 14 months old, she woke up and she was gagging and it smelled like bile, and I was like, oh my gosh, bowel obstruction, something. So I ran her to the hospital right away, because her only symptom beforehand was constipation for like 5 days. So, I did the mom thing. I watered down her milk, I gave her fruit juice, but it wasn't helping. So when she woke up and she was gagging, it was like, red flag, something's wrong. Anyways, when my daughter was 14 months old, she was diagnosed with stage 4 high-risk unfavorable neuroblastoma, which is a solid mass tumor, cancer in her stomach, and it had spread. She had tumors on her bones in her skull, tumors all down her legs. She spent 73 days vented, trached, and sedated in the ICU for her first 2 rounds of chemo. And I was a pre-nursing student, and all of this was like brand new to me. I had never heard of this kind of cancer. I still had honestly no idea that kids got cancer. Like, it was just like this, like rose-colored glasses. I never thought it would ever happen to me. And in that time, in that diagnosis with my daughter, I had the experience of having child life, and the medical side of social work opened my eyes to that whole other side and the whole other needs. What brought me to social work was the social workers at Phoenix Children's Hospital, where my daughter was treated. They are the ones that taught me how to advocate for my daughter and how to stand up for myself and how to participate in her treatment and her diagnosis. They empowered me. They said, you can do her dressing changes, you can do this, you can do that, you can hold her for this procedure, as involved as you want to be, you can do it. And that, I think, is what helped me get through that storm without even realizing I was walking through
a storm.
Chaos, like absolute chaos. I felt empowered. I felt like this diagnosis that is terribly awful was not going to be my whole life. It wasn't going to bring me down, I guess. And that's because of her social workers there.
So that brought you to social working, the fact that they made you feel empowered, that you wanted to help other people in the same nature.
Correct. Now I'm looking at medical social work myself. I'm gonna see about other ones maybe, but I'm looking into medical social work because I hope to have one experience in life where I get to give that to somebody else.
Right. So when you were going through all this traumatic diagnosis with your daughter, how did you handle it outside of, being empowered with the social worker? What was another way that you handle your stress?
Honestly, I ate a lot. I had a really bad, I didn't have self-care. I ate a lot. The hospital cafeteria, in case anybody doesn't know, is open at 1 to 3 a.m. All they offer is cake and ice cream during that time, and then they close again. And when you're up all night watching Netflix, listening to the beep of the machines and eating ice cream, I gained a significant amount of weight. I was like a size 20-something, and I just didn't really have good self-care. I did enjoy the good days with my daughter. I basically to get through that time, I poured everything that I had into her.
There's a lot that you poured into her, huh?
Yeah.
A lot of love. Yeah. All right. So what's the outcome of your daughter? How is she doing now?
She is 6 years, no evidence of disease. So we can officially use the word remission. The word remission is not used until somebody actually goes 5 years without any evidence of their disease, which, again, I didn't know until I was on this side of the boat.
Right.
So now she goes she does annual checkups now, mostly blood work, unless something comes back that indicates she needs a scan. She's not necessarily out of the woods yet. Like, she is cancer-free, which is great, but she had a lot of high metal chemos. Therefore, she is very small for her age. She's in like the 4th percentile for height and weight. She's going to be 9, and she wears like a size 6 or 7. Right now, our concern would be her her hormone developing. We follow up with endocrinology regularly right now because we don't know if her ovaries are going to work or if she's going to hit puberty or if any of that. So it's a waiting game right now, but we just completed a hormone study a few months ago, and we have to do another one in like 6 months. As long as her system has some kind of indication that it's going to do something, we will put off hormone therapy for another year and just see what happens. But that'll be a decision we have to make soon. She's at the age where if you have to do hormone therapy, you have to do it like soon.
So overall, her health is...
It's good.
Great. 1 to 10.
On a 1 to 10, I would definitely say that she's a 9. I mean, what's wrong with being short? And what dad doesn't want their daughter not to have a period? And
Right.
I mean, I think it's all small fries. I from the moment she got her first chemo, I volunteered to be a surrogate if she needed. Just get her to the age to make that decision.
It sounds like you're a really dedicated and mom. I mean, so what about your self-care now? What do you do now when you are faced with these stressful moments with the care of your daughter?
Oh, my self-care now is much better. I love to hike, go outdoors. I hike Camelback Mountain. I'll hike Silly Mountain if it's got to be up and down real quick. I love to skateboard.
Oh.
I did that back when I was like 16, and now within the last year or two, my daughter's picked it up too. So I'm like right back at it, like I never stopped. It's a lot of fun to pass those little things on to her, to teach her how to stand on a skateboard and ride with me.
Yeah, right.
What else do I do? I tried to go to the gym, but I don't like the gym because I feel like everybody's really judgy. I'm probably the judgy one, but
probably.
I did really good. I lost quite a bit of weight, like 80 pounds in a year. Once all that was done, I started to get back into it, and I'm actually finally like healthy, not obese, not any of that. I'm like at a good weight for my height, and so.
So how your daughter is adjusting to school and her friends? How is her social life?
She is good, I believe. Her teachers are always saying that she is like the highlight of the class. She's funny, she's sweet. Apparently she talks to everybody still, and I guess the 3rd grade now is where they kind of section off boys and girls. And her teacher's like, she's one of the only girls that will talk to girls and boys. Like, she's friends with everyone.
That's good.
She actually is starting on the student council.
Oh, that's good.
She's got good grades, and I guess I don't know how they pick those kind of things. I tell her every day I'm very proud of the person she is, because that's not the student that I was.
A lot of this is different from what our kids has become or becoming.
Yes.
Yeah, I understand. So social working is important to you.
Yes.
And why is it important?
Because I think in the end, we are all people who just want to be people around other people. And we just want people to understand that it's okay that we can be different. We all have a human need, and then we all have social needs and justices. For me, the part of social work that's most important, I guess, is advocacy. And everybody wants someone to advocate for, and everybody wants to have someone advocate for them, whether they know it is that term or not. But
have you learned a lot so far from your classes that was offered, or you've been taking in your career field?
So far, I think so. I'm enjoying NAU's online classes. It definitely is what helps me be able to pursue this field of work. I'm interested in how theory is one thing and practice is the other thing, and theory is what we back up our practice with. But sometimes, if you're in the middle of something with somebody, you don't have the time for the theory to be like concrete, I guess. So I'm enjoying the experience. I think that's what I need more of as a student, is just more experience, and that's the whole point of these classes and these interviews and volunteering. And while it feels like a lot, it's definitely helping me learn my areas of weakness and my strengths. And
What is your area of weakness in social working? What do you think would be the most fearful, or most, I don't know, what are you most scared about in social working? What is your stressors? What are your fears?
I think my fears would be, or my fears and weaknesses.
Maybe I should just say weaknesses more than fears. Fears is a strong word.
But I would say just my lack of practice, not lack of knowledge. I feel like I do have a lot of knowledge about social work, but I just don't have a lot of practical implementation of that. So I'm looking forward to field work.
Yeah.
I feel like I definitely have a lot to learn still. I'm in the BSW program, and the people I work side by side with every day are MSWs.
Right.
And I know that I have a lot to learn. But I do have the opportunity to pick their brains all the time too. Like, oh, why'd you do that? Why do we do it this way? Why not this way?
Right.
Oh, okay.
Right. So you're feeling like social work is a juggle between theory and practical.
Yes.
Yeah. So put it into work, what you learn.
Exactly.
So social working is a lot of work. You learn a lot on the job.
Yeah.
On the job skills. So that's good. And you have a backup, because where you work, you can actually always pick their brain and learn a little bit more. Mm-hmm. That's kind of up more than most students have. Because you're right there. You can say, hey, what's going on? So I think that's good. So how are you juggling your online classes to care for your daughter, just family life, and your, let's say, soon-to-be fiance? Let's hope that.
Teamwork. I have a great co-parenting relationship with my ex-husband and his new wife, my soon-to-be fiance. He's great. He picks her up. I drop her off. We have a 50-50 arrangement with the other parents. Teamwork. It takes a village. I need you guys to do this because I got to do this assignment. Whatever.
Yes, it really do take a village, and it's nice to know that you have a backup, or you have a support system in place. Mm-hmm. So you can actually conquer, finish your schooling. How much further do you have to go?
I think I'm supposed to be done spring of 2019 is when I'll be done. Field placement is when my field placement is.
Are you nervous about that?
A little bit. I have to apply in January, and I'm still debating between, I want to do, I think, CPS or like the police, DPS, one of those two.
So those two fields are different than where you want to be in social working? Yep.
I want to take this time to experiment or see what the other things are.
Do you have any fears or,
You have 1 minute before you hit the limit of too much time.
Oh,
I don't know how to tell you I tried this, but I was like.
I know, I saw that and I was like, what is he doing? Okay, so in conclusion, you are juggling a lot in your life, and it sounds like the help of your daughter and the advocacy that you have received in the hospital has actually empowered you and encouraged you to move forward and keep going with your daughter. And it's really good to hear that you are self-keeping by exercising, and you're including your daughter with that, so you're getting some mom one-on-one time along with that.
Yes.
So, it is really good that you're, social working, you have that extra teacher at your job as long to help you with your career going forward. So, to keep up good work, and I wish you, the best with your daughter. I'm hoping you get that ring soon. And I'm concluding this interview, and thank you for your input to it. Good. Do you have any questions? You want to share anything? Last 60 seconds, I believe.
Nope, I'm good. Thank you.
You're very welcome.
Bye.
Bye.